Hi, welcome to the next edition of the Beyond the Blade podcast. We're here again with Ali and Jasmine, which are two of my nurses from our practice, and we're going to be talking about everything that is non-surgical. So we know that a lot of people look at us as a surgical practice, and that's understandable. But we want to let everybody know all of the other products and all of the other devices that we can offer you to enhance your overall rejuvenation, your skin tightening, maybe reduce some of the volume loss that you've had with age in different areas of the face and the body. And so we have a lot of other options for you that are not just surgery. So we'll start it off with Ali.
So one popular thing that we do offer in the office is going to be Botox, fillers, and also the topic about sculptra. So we do get asked a lot when patients come in for consults or follow-ups or whatever it may be, Dr. Z's opinion on doing sculptra to the buttocks.
Yeah, so sculptra to the buttocks has been a really big topic for a lot of years. A lot of people have been looking for alternatives on how to enhance their buttock without having to go to the operating room, without having to have liposuction and the whole fat transfer situation. So Sculptra is basically a synthetic product. It's very safe. The technical term is poly-L-lactic acid, and it's a filler that we use for different parts of the body. We can use it in the face, we can use it in the buttock, we can use it in the hands. It has a lot of applications. But specifically to answer Ali's question about the BBL with Sculptra, my experience has been over time that you require large volumes of the product to really get a great result. And so, this is off the shelf, so it's easy, but it is somewhat costly when you start adding up a lot of the vials. If you're going to be doing large volume injections of Sculptra. The way Sculptra typically works is that once we hydrate the product, we're then going to inject it and wait about 30 days to see the final take or the final result of that first session. And so typically this is a journey, whereas a typical Brazilian butt lift in the operating room is one surgery with an immediate result. The Sculptra BBL will take several sessions to get to where you want to go. The other aspect of it is that it can be a little bit uncomfortable to have these injections performed because we have to use a little bit of a longer needle, larger bore needle. So I always recommend my patients to get sedation. We can do a combination of topical anesthesia. We can do oral sedation, or in my opinion, the best would be IV sedation. And that just means that you're still awake, you're still breathing on your own, but you don't have a tube in your airway, which would be general anesthesia. And that way you can tolerate the procedure very easily with minimal to no discomfort whatsoever. And it just makes it for an overall better experience for you. So that's basically, that's Sculptra.
What about Aveli?
So Aveli is another product that we're using for dimples, basically cellulite dimples of the buttock. It's been FDA approved for that indication. We've loved doing Aveli. You can do Aveli in the operating room, and you can add it to one of your other procedures, or you can do Aveli by itself. Again, just like Sculptra, this is basically using a longer type instrument that you're going to be more comfortable if you get it done with sedation instead of just being fully awake with local anesthesia. But we have done it every which way, and it just depends on your pain tolerance and a little bit of your anxiety levels and how you perceive the process. But Aveli is fantastic specifically for buttock dimples or buttock cellulite. We get a lot of questions about thighs. Can you do Aveli on my thighs? I have a bunch of dimples on my thighs or cellulite on my thighs. The answer to that is no, it's not good for that. It's not going to get you the type of result that you're really want to be, achieving and you're going to be happy with.
I think a good thing to bring up with Aveli as well that I recently learned, looking at the pictures, was differentiating between actual cellulite dimples and skin laxity.
Mm-hmm. Yes. So skin laxity is a big problem because with Aveli, what we're literally doing is we're cutting the bands that are pulling down on the skin and causing the dimple. The great thing about Aveli is that it's very specific and it targets those individual bands. It's not like we're destroying all of the sub-architecture of the skin and the buttock. We're just going specifically to that dimple and we're releasing that band one by one. But you do have to be careful with skin laxity, because if you have a lot of loose skin, it's not going to be a great procedure for you, because cutting those bands could sometimes cause a little bit more laxity to your skin. So it's better to have a little bit of a firmer buttock in that regard.
Yeah, so as long as you're a candidate, it's really nice because it can be done in one session for the Aveli with the desired outcomes. But maybe we can talk a little bit about recovery. Is it as extensive, let's say, as a BBL or a lipo?
Right. Yeah, no, it's nothing like a BBL, nothing like a lipo. Aveli is very simple to recover from. You may get a little bit of bruising, a little bit of inflammation, just a little bit of swelling in the area of the buttock where we did the procedure, but it's a very fast turnaround. You're basically working the next day. You don't have to take any time off. There's no downtime, and it's all really controlled with some Tylenol, and you're pretty much good to go.
That's true. I think if we dive maybe into facial procedures, there's a lot of patients that are that in between age, or you're not ready for a face and neck lift, but you kind of want to start making the strides in bettering your skin quality. So what are your thoughts on that? What should you do?
Yeah, so nowadays what has revolutionized facial rejuvenation is what we call radiofrequency energy. So radiofrequency energy is being applied in very different ways. In the body, I do radiofrequency application using J plasma, which is from a parent company called Renuvion. And that has also been FDA approved for skin tightening or skin contraction. Now, that's typically done in the operating room setting. If we're outside of the operating room, we can offer radiofrequency energy through what we call microneedling. So microneedles are basically using a device called Morpheus8. And Morpheus8 comes from basically the technology of penetrating the skin with about 24 very, very tiny microneedles that can penetrate through up to about 4 to 5 millimeters deep into your skin. And when it reaches that depth, it will apply radiofrequency energy through those pins to cause skin tightening. So it is phenomenal technology. It has really changed the game. All the celebrities are using it. They've been using it for a while. And the way it works is we apply a topical numbing cream to your whole face, your whole neck, and we let you hang out watching Netflix in our office in the exam room for about an hour. And then I come in and we go ahead and perform the procedure. I do also have a registered nurse who I have trained to do the procedure as well, and she does it as perfectly as I do. And we get some fantastic results with the microneedling and the radiofrequency energy together. If you want to take that a step further, then you would consider using what we call platelet-rich plasma, or PRP. PRP has really great qualities because it's your own body. We basically draw a small sample of blood, we spin it around, and we separate the layers to get the plasma. And the plasma has the growth factors and the stem cells that help regenerate your skin. So right after we do all of that microneedling treatment, that is the time where your skin is ready to absorb all of that plasma. And it really helps to get you better skin tightening, better skin rejuvenation, better skin complexion, better texture to your skin. All of that in basically a 3-session process. So Morpheus is basically once a month for 3 months, and that's where you're going to get the introduction to the results. And then you're going to want to do maybe like a maintenance every 6 months or 8 months, just because we're all aging every single day. So, Morpheus is something that you should consider doing periodically to just maximize your results.
Also, I guess the next topic would be a lot of patients are scared of scars when it comes to plastic surgery, but they don't know that we offer laser therapy for scars.
Right, exactly. So our laser therapy device is called Lumecca. It's an IPL laser, which is intense pulsed light. It is not going to burn you. It doesn't take off any surface of the skin. It's not an ablative laser, meaning it doesn't damage the tissue. What it does is basically through light therapy, it helps to transform your scar to get you a better looking scar. So instead of a reddish, pigmented, like pinkish scar that a lot of patients can get, the Lumecca will basically change the color of the whole scar wherever it's applied, and it'll make it look like your normal skin color. So it's not going to be as red or as pink or as noticeable. And also it helps to kind of thin the scar a little bit. So, you just get an overall better result with that. And if you're thinking about using it, you want to do it within the first 4 months of the procedure. If you wait too long, then basically it's a little too late because the scar is completely mature and it's not going to transform. We're also using Morpheus8 to the scars as well. And that penetrating action of the microneedles into the scar tissue helps to soften it and also helps to remodel it. And if you apply plasma, it just helps to stimulate it and just give it a better scar result.
Could you do Morpheus8 and Lumecca to the scar together?
Yes, you can. You just don't want to do them on the same time, on the same day. You want to give them at least 3 weeks separation between each treatment. But we have a lot of patients that like to do Lumecca to their face. They complete their 3 sessions, and then they do Morpheus with another 3 sessions. And that is basically the Rolls Royce. That's the top of the line treatment for facial rejuvenation. Again, when you are a younger patient, typically between the ages of 30 and 55, around there, that's where you're going to be using these types of non-surgicals, because there will get to be a point where all of us are going to get there, where this is going to be too much skin. And so Morpheus and Lumecca are not going to be the appropriate treatment for you. And instead, you may actually need a surgical alternative like a face or a neck lift.
Right, yeah. Maybe now we can transition into Botox and fillers, what your thoughts are. Some patients wonder about the difference between maybe lip fillers and fat transfers to the lips.
Yeah, so the lips have been super, super popular to fill over the last 5 years. It's a very much a thing in social media. There are 2 ways to fill your lips. You can either use a synthetic substance like a filler, which Jasmine was bringing up, and that could be something like Kiss or Juvederm or any of the products that are basically hyaluronic acid. And the reason we use hyaluronic acid is because we can use a product called hyaluronidase to basically melt it away if it were to be too much filler or you're not really happy with the result. Now, I think the best way to get lip filling is through using your own body fat. So when we do procedures like liposuction, I'm able to extract some of your fat, and it goes through a very special process to obtain what we call nano fat, which is small particle fat that then we use to inject into the lips. And it can slide through a very thin cannula, and we can give you really nice lip rejuvenation, lip fullness, and volume without having to use a synthetic substance, which sometimes can cause nodules to form in your lip, and it can be hard to dissolve even with hyaluronidase.
On the topic of fillers, we get a lot of questions about fillers to the under eyes.
Mm-hmm.
Yeah, so fillers to the under eyes is a very touchy subject. I am of the belief that the best option for you there is facial fat grafting for under eyes. If you start using fillers in that area, unfortunately, depending on the thinness of your skin, the color of your skin, the texture, you can sometimes get a little bit of a bluish discoloration in the area of the under eye. And that is not attractive, and you're not going to be happy with that. So it's also a very dangerous area to be doing a lot of fillers in, because there's a lot of little tiny blood vessels around the eye that can, have some of that filler enter into the bloodstream, and it can cause some very significant complications if you're not careful. So again, this is again another important topic about who is doing your fillers, who is injecting your face with all of these products like Botox and fillers and all these things. And there's no other person that understands the anatomy of the face better, in my opinion, and I'm a little bit biased, than a surgeon. Because when you open up the face, you have to know the anatomy of every single blood vessel, every single nerve, and every muscle that is there, because you need to know where you're going. You cannot be lost as a surgeon. So we have a lot of training when it comes to where are the major blood vessels, how to protect those blood vessels from getting injured when you're injecting somebody's face with fillers, and so you don't have these types of complications. Fat is a little bit more forgiving. Fat is a softer substance. It's your natural body, and there are a lot less complications with facial fat grafting than there are with filler injections.
Also, I know we have some patients that like to get their fillers, but they're also interested in doing Morpheus. So there is like a misconception going around that if you do Morpheus, you'll melt your filler away.
Oh, this is a good one. So this is a street myth. This is a legend going around now. So no, Morpheus and fillers, they're not competing with each other. They're totally different treatments, right? So depending on your current status, let's say you had fillers done last week, I would postpone your Morpheus8 treatment for at least another few weeks to let that filler settle in. But that doesn't mean that when we do the Morpheus8 that we're going to be going so deep down that we're going to be melting away your filler. It doesn't work like that. That's like the same idea of feeding the fat when you had a BBL. That doesn't work that way. Morpheus8 is only able to get into about the 4 or 5 millimeter range. You are not, or you should not be getting injections of fillers in that very superficial layer of the skin because that's not how you inject fillers. Fillers are meant to be injected deeper into the facial soft tissue, and they are going to be in a position where they're not going to be affected by Morpheus8 because they're so far down in that Morpheus8 will never be able to reach into that depth of the face to be able to dissolve any kind of filler or melt any kind of filler away. So quite the contrary. I think that when you marry the two, Morpheus8 with fillers, you really get an amazing result because you're getting volume rejuvenation with fillers and you're getting skin tightening and texture remodeling of the skin. So again, those two, they should go together. They shouldn't be apart, and I don't think anybody should be worried about melting away fillers.
What about threading? What do you think about threading?
Okay, so with threading, I've never been a proponent of threading. I think that threading is not a great idea because those threads are going to stay in your face for a very, very, very long time. They cause a lot of scar tissue, and the way in which they're placed through the skin is very unpredictable on how you're getting the right pull and the direction of the pull that's going to be lifting your face and causing an improvement. Later on, what ends up happening is that you're going to end up needing a facelift, and those threads are going to be stuck in your facial soft tissue. And then the surgeon's going to have to figure out a way on how to pull those threads out of your face without causing any damage, and then trying to lift all the facial soft tissue. And those threads, they cause scarring internally. They cause what we call fibrosis. And that is not good for your facial soft tissue over time. And I've seen cases of women that have had threads, and then you can see where the threads have maintained their pull, but then all the skin around that has started to sag. So it just looks very, very odd, and it's not anything I would recommend. All right, so this was also another great session. Want to thank everybody for joining us for this edition of the Beyond the Blade podcast with Jazz and Ali, and we hope to see you for the next one.